Hi, this is Charley with Psychedelic Invest. Thanks for joining me today as I sit down with Ryan Field, the CEO of Kernel, which is a fascinating company working to revolutionize neuroimaging and accelerate treatment discovery. Let's get started. All right, Ryan, thanks so much for joining us today. How are you doing?
Thanks for having me, Charlie. I'm doing well. Yeah, I'm excited to share a little bit more about what Kernel's been up to and all the progress we've been making in the past few months.
Yeah, absolutely. And there's been a lot of it. I mean, I wrote an article, I think about 3 weeks ago on the study on ketamine that came out. And then like the next week, there was more news. So it sounds like you guys have been really busy.
Yeah, we had two really big scientific publications come out this summer, both in scientific reports. One was the work on ketamine that you saw, and the other was a study looking at alcohol and how it affects the brain. And then just last week, we announced the release of our Flow 2 headset, which is kind of the next generation neuroimaging device that we've been building. And obviously, we're really excited to get that out into the world.
Yeah, absolutely. Just real quick for our viewers who aren't as familiar with Kernel, will you just tell them a little bit about what you guys do and about Flow?
Sure. Yeah. So Kernel is, I guess, at its core, a neurotechnology company. We've spent the last 5 years really studying the best ways to non-invasively measure the brain, and then taking all those things that we learned and turning it into a product, which is our Kernel Flow product. And the fundamental technology inside of Kernel Flow is very similar to that what's used when you go to the doctor and they take your blood oxygenation. So they put this pulse oximeter on your finger and it measures kind of a global measure of blood oxygenation. What we do is use similar techniques with light and, in our case, lasers, very short pulsed lasers, to measure the blood oxygenation in the brain, specifically in the cortex, the outer layer of the brain. And why this is interesting is because when your brain starts to do things, you see these local changes in blood oxygenation. So we're measuring kind of a signature of metabolism from the neurons in the brain. And that tells us what parts of the brain are active at a given time. And so we're able to use this then to see how brain activity changes in response to different things, whether it's ketamine or alcohol or any number of drugs or interventions or things that you may do to impact your brain. So that's a very high level of what Kernel is and what we're measuring. And I'm happy to dive into any more details or explain further.
Yeah, absolutely. Well, I'm curious about the upgrades that you've made with your next generation version, Flow 2, which I think came out or was announced last week or 2 weeks ago.
We released our first generation device back in 2021. I think we announced it kind of late 2020. And this was the first time we had really taken all of the technology we'd been building and packaged it into a single headset. We sent this out to a handful of early partners and people who wanted to explore doing measurements with the device. And we also used that first generation device ourselves to do things like the ketamine study and when we looked at alcohol in the brain. And so over kind of the 2 years that Flow 1 was out in the wild, collecting data, we were learning, understanding, its strengths and its weaknesses. We were also in the background building a new device that took into account everything we learned from those experiences. So Flow 2 is really a huge upgrade from Flow 1 because we have 2 years of learning in like real world settings of what it's like to measure the brain at scale in a very efficient and low cost way. And at the heart of this upgrade, we designed a new sensor. So one of the key innovations that Kernel made is we designed custom sensors. And so Flow 2 has a new generation of custom sensor that increased our sensitivity, so our ability to measure changes in blood oxygenation in the brain. It reduced our power consumption, so the system runs using less power, and it just is a little bit more comfortable experience. We were able to redesign the mechanics completely so that it fits on the head better, and it fits more head shapes and sizes, and just kind of everything that we learned and struggled with from Flow 1, we kind of made better and improved in Flow 2. So we're really happy with where it turned out. We're really excited because Flow One, we were able to do a lot of pretty incredible things. And we're excited to see what we'll be able to get done and what some of our partners will do with Flow 2 in the near future.
Yeah, absolutely. Because correct me if I'm wrong, but Flow 1, the sensor technology was something that's never been created before. Like this was a novel technology that you guys created, and so now sounds like you've done it again.
Yeah. So what Flow 1 was is it had been a couple decades of work in academic space where researchers had built kind of these room-sized setups to use this technique called time domain near infrared spectroscopy. And the fundamental concept again is just pulsing laser light into the head and looking at the temporal properties of how it passes through the tissue. And so they had shown in kind of like limited coverage, right, like a few locations on the head at a time, that you could do this type of technique and measure brain activity better than you could in any other kind of non-invasive optical way. And so what we did is we looked at that and said, okay, what other areas of technology do a similar thing, and how can we get something that is a room-sized set of equipment down into something you can wear on the head and actually deploy at scale. And what we looked at were these depth sensors. So you must know that Apple included a LiDAR sensor in, I guess, maybe iPhone 12 Pro or something. So they have this 3D sensor now that you can use to map a room or do all kinds of like AR type things. And to do that, they use very similar technology stack as what we needed. So we were able to kind of ride the existing kind of consumer electronics and LiDAR technology development in order to build a system that could be fully integrated to measure the brain, which is kind of cool when you think about it. They're completely different applications, but a very similar technology at its core.
Yeah, that is fascinating that you guys were able to bring all of that together. I want to hear more about what the goals for this tool are. I mean, I know you guys have been doing studies to learn about it and test different things, but you guys have said that you want to get this in the hands of 1 million people. So what is the application that it would be used for on such a large scale?
Yeah, so that's great. The kind of framework of how to get this into 1 million households is really kind of a guiding principle for us. When we look at the technology we're developing, we want to build something that really can be deployed at like a societal level. And if you look at the technology and say, like, could this fit, find its way into 1 million households someday? And the answer is no, then we set that aside and don't do it. So you can look at all the ways that people image the brain today, right? Like some people have had an MRI. So you go to an imaging center and there's this huge machine with a giant magnet and it images the brain. And it gets these really nice crisp pictures and you can understand about the structure and different things going on with it. But if you look at that technology, you could never answer the question, will this go into 1 million homes someday? You could never say yes to that. And so we kind of use this framework as a guiding principle for us on what it means to be a scalable neurotechnology. Is it really has to be able to be something that could be in homes of people maybe in a decade. I'm not saying it'll happen tomorrow. The other kind of familiar framework that we use to talk about this is, if you draw parallels to computing, in the kind of 50s and 60s, right? Like all the like real computing were done at these universities with these mainframe systems, like really huge computing systems. They weren't things that an everyday person or even like a common, like someone who's a researcher trying to answer some questions, like it's hard to get access to these things. They're just limited, expensive, and hard to maintain. And that's really where, I feel like the world of measuring the brain has been. It's like in this mainframe type of world. You can also say like, oh, well, at the same time as these mainframes existed, they also had calculators, right? Like there was a personal device that you could do some computing with, but it's a calculator. And it's so simple and basic. And that's what consumer neurotech is to me right now. It's like it's very limited in what you can do with it, and it's very simple. Sure, you can make it inexpensively and scale it, but there's a limit to what you can do with it. Mm-hmm. And so what we've been doing at Kernel is trying to build the first PC neuroimaging technology. So you've got this mainframe that's highly capable. You've got a calculator that's like, easily scalable, but can't do very much. What you really want is a PC. And I think that we've kind of gotten there with Flow 2. This is our first kind of PC moment. And I think, what we've done and how we've designed the system, we're ready to scale up into larger volumes as the applications start to emerge. So you asked a great question, right? The lead into this was, what's the application? How do you get 1 million people to even want to use these? And, this is where we're focusing all of our energy now at Kernel is, developing these kind of first use cases in a really meaningful way. And I'll describe a little bit about how we think about it. So when we started with Flow 1, we focused on healthy people. Our main question was, can we measure the brain and can we measure it reliably? Can we do a few challenges to see if we intentionally change the way the brain is working, can we measure that change? And so this is where if you use alcohol or ketamine, like these are known psychoactive substances, they change the way the brain is working. And we showed that we could measure that. So these are just in healthy people that have nothing wrong with them. But we could, for the first time, really say, hey, you can measure this. You can do it in like pretty casual setting, in a clinical setting. In ketamine, we did it in a clinical office, so like on a psychiatrist's couch, basically, and recorded the data there. So we could show that you could do this in the field in, say, like ecologically valid settings, right? Like it's not in the tube of an MRI or in a research hospital where you have to, go to this specialized place. It's in a pretty commonplace setting. So we did all this work with Flow 1 and healthy people to show that this could be done. And now with Flow 2 coming online, what we've decided to do is really focus in on a couple of clinical applications of it. And if you look kind of around the world at what are some of the biggest problems that we have today related to the brain, two, I think, that are quite different come to mind, and I think a lot of people can resonate with. One is mental health. Worldwide, the global prevalence of mental health disease is something like 1 billion people. And, top of those lists are depression and anxiety. And so if you could do something to really help, figure out how to treat and get people better faster, I think there's a big, meaningful impact that you can have in that space. The second area is kind of related to our aging population. So we know that people are living longer, and as they live longer, they start to have more diseases of cognition. So cognitive decline, dementia, Alzheimer's, and things become more prevalent. And so we're really focusing on these two angles. One is more cognitive function related to kind of the brain as it ages. And the other is mental health. And, how can we help figure out which treatments are working or which treatment is right for this individual. And so it's this whole idea of precision neuroscience. That's really what we're talking about here. Is our first application of Kernel Flow, we think, will be in this space of precision neuroscience, where you're using measurements to really guide the way that medicine is applied.
Yeah, absolutely. So I know you guys are compared to Neuralink a lot, but it kind of sounds like the path of commercialization is a little bit similar, where you're focused more on like clinical applications for people who are suffering. But do you see down the road it being a tool where people, like once we have a better understanding of the brain, someone could have it at home and use it maybe to improve performance at work, or athletes could use it as like a biofeedback tool?
Absolutely. And, we've thought a lot about this question, right? Like, do we do something like, elite performance optimization first, or something like a clinical problem, like solving a clinical problem first? And we chose to go clinical first because we feel like in the process of solving this clinical problem, that's huge. It's like a big, well understood problem that we think we could make a difference in. We will also kind of establish the platform for measuring the brain and doing things to improve it over time. If we can really solve big, meaningful problems first, then I think we'll be able to learn enough that we can apply it to non-clinical settings and really, show that this platform is something that can be applied in many ways. And, we pick these areas because they're big problems. They're big problems the world is dealing with. And we want to do something to help with the technology we've built.
Yeah, absolutely. That's wonderful. Will you tell me a little bit more about how this technology could revolutionize our understanding of the brain? Because I mean, at this point in scientific study of the brain, we really don't know that much. So where do you see this taking us?
Yeah, I think there's a lot of potential for, just really understanding the brain better, because now we have a tool that can measure a pretty robust signal from the brain and do it at scale. So we're no longer making this trade-off between having a measurement that can scale, where you can, use it widely and inexpensively, and a measurement that's high fidelity, very robust and strong, something like an fMRI, right? We kind of fall in this middle place where we get fMRI-like signal from the cortex, so the outer 2 centimeters of the brain, where a lot of our cognitive processes are happening. A lot of things happen in that outer layer of the brain. And so now that we have this tool that you can use to collect data that's rich and low cost, I think we'll build some of the largest data sets in the world that will allow us to take advantage of some of these modern machine learning and AI techniques, and really start to learn things about the brain that we couldn't previously, because there wasn't enough data. There wasn't enough high quality, very rich data. And, I think at the end of the day, if you're going to apply some of these tools like machine learning and AI, then you need to have good data coming in. There has to be a lot of information contained in that data for the algorithms to find and understand and make sense of. And I think with Kernel Flow, we've really set it up so that you have a tool now that can feed those sorts of frameworks and really start to understand and discover things that you maybe couldn't before. And, our whole focus around these clinical areas is generally on making biomarkers. So biomarkers are, some signature, some patterns of brain activity that tell us something about what's wrong with the brain, or maybe what's normal about the brain. What does a normal brain look like? There's a pattern that matches with that. And, what does a person who suffers from anxiety or depression, or, what does a person who will respond to a given treatment for depression, what does their pattern of activity look like? So we can help to focus and target and tailor treatments to get people better faster. And that's really what we're after, is these general things called biomarkers, which allow us to understand something about the condition just based on the patterns that we see. It's a pattern recognition type of approach.
Yeah, and the fact that this is a portable device also plays a huge role in that as well, because, people aren't having to come into a hospital or a research center where there's this huge machine that can't be moved. And so you're able to just get around to so many more people.
Yeah, and our initial, we have a few partnerships going on right now where we're working with clinicians. So we're working with their teams in their offices, right? So their patients are coming in for treatment already, and they're getting measured right there in the psychiatrist's office or right there in the neurologist's office. They don't have to get referred out. They can get the measurements at the primary care place, which I think is really going to be a game-changing thing in terms of collecting meaningful clinical data and the brain imaging data to go along with it. So I think, like you said, it's really once you lower the effort down to where you don't have to go to another site, or maybe some people have to drive an hour to go to a facility that has good enough imaging equipment to measure the brain today. And this is something that really could be in every primary care office everywhere. And that's how we get up to these numbers of 1 million devices in the world, and then eventually into everyone's homes and used for other applications. But initially, our focus is really on finding these biomarkers to enable precision medicine, precision neuromedicine, really solving problems of the brain in the clinical setting.
Yeah, I imagine very cost effective as well, because you're not, I don't know the exact prices on some of these other neuroimaging devices, but I imagine they're in the thousands of dollars, and then you have to deal with insurance. Whereas this is what about $100K, and then it can be used again and again. And so I imagine it's very cost effective.
Yeah, it is. So we definitely are much cheaper than some of these big institutional, installations that are needed to measure the brain today. And our cost of running it is much lower because you don't need specialty technicians, right? Like I can run the system. You could probably learn to run the system with, a day or two of training. Like it doesn't take much to learn how to put the headset on correctly and get a good measurement. And I think that's really a big time game changer, is that the cost of acquiring the data becomes so low that you can really have it be part of standard care. And that's our hope, and our goal is that we can identify a few biomarkers that have enough value that the medical community, both providers, the ones who are delivering care, the payers, the insurance companies who have to pay for the care, who are both sides are going to want this technology there, because the providers can get their patients better faster, and the payers can see that they spend less money to treat these patients once they have more data and they understand more about the underlying function of the brain or dysfunction of the brain, so it can be treated more efficiently.
Yeah, that's major, and a huge shift in care for a lot of people. Are there any shortcomings in the current design? I know you guys just released your new flow too, but are there any shortcomings that you're already aware of and trying to overcome for your next version, if you can share that with us?
Yeah, so I would say there are no shortcomings that prevent us from being in clinical settings. Yeah. I think our number one thing that we still focus on is just the cost of the system overall and how we get that down over time. And, I'm sure you've seen the device. It's a whole head coverage device. So we really focus on measuring the entire cortex, so as much of the brain as possible. And as we go forward, what we want to do is have a more tailored approach where, if this is being used to screen for dementia or like different cognitive decline, then like maybe we could tailor the headset to be something that's smaller, cheaper, lighter weight, and specific to that use case. So we kind of move away from being a general purpose machine and something to be a little bit more specific, which helps drive cost and other things. And then that improves accessibility. And I feel like accessibility is something that's on everyone's mind. It's great when new technologies, especially new medical technologies, come to the market. But one of the biggest drawbacks sometimes is that they're too expensive or too limited, that not everyone can benefit from them. And we really feel like the way we've built Kernel Flow and the capabilities it has, kind of tend toward being something that everyone, like realistically, could have access to someday.
Yeah, that's amazing. And compared to other neuroimaging devices, PET scans, fMRI, EEG, what do you see as the relative advantages and disadvantages of FNIRS?
Yeah, so great question. And, each of those technologies you just described measure something a little bit different, right? So, PET scan, they're looking at radioactive tracers and they can be in the brain. MRI, again, it's looking at the way that the brain, if you're looking at fMRI, you're looking at the way the brain is functioning. It's kind of the whole brain, and it's measuring a hemodynamic signal. So it's very similar to what we measure in terms of changes in blood oxygenation. And then EEG is measuring the electrical signals of groups of neurons as they fire. And so it's a faster signal, but it struggles from being less spatially specific to get, as the electrical signals pass through the scalp, they get distorted a bit. And so it gets hard to localize where they come from. And then MEG, which is the magnetic version of EEG, those magnetic signals can pass through the scalp without being distorted. But the sensors that are used to measure them are very expensive and complex. Today's standard use a technique called squid sensors, and they require cryogenic temperatures to operate. So you need liquid helium, which is expensive and kind of limits the use cases. There is an alternate design that uses what's called optically pumped magnetometers that are a little bit more inexpensive and can be easier to use, but have its own set of challenges. And so these techniques all measure something different about the brain. And FNIRS and Kernel Flow is an FNIRS device with EEG integrated in. So we kind of take FNIRS, time domain FNIRS, which is this advanced version that uses the LiDAR sensors. We take time domain FNIRS, which gives us an fMRI-like signal in the cortex, and we combine it with a few EEG channels to give us some global kind of more fast transient responses to what's happening in the brain. And so our advantage is obviously the portability, scalability, ease of use. Our disadvantages, we're a non-invasive technology. We can only measure about 2 centimeters into the brain. We need to make good optical coupling with the scalp. And so we're always kind of working to make contact with the scalp, where things like fMRI, it's truly non-invasive. You don't have to touch the person in order to get a good signal of the brain. So there are all these different trade-offs. And at the end of the day, I think what it comes down to is like, do you want more accessibility and ease of use in exchange for a little bit like of a reduction in, the data quality, but still keep it high enough and robust enough that you can do meaningful things with it? And I think if you're okay with that trade-off, then that's really where Kernel Flow falls in, is that we have a really robust type of data, and it's something that you can do in an accessible and scalable way.
Yeah, so this is really like the people's neuroimaging device.
Yeah, I mean, I wouldn't claim it to be the people's yet, because it is a $100K device, and that's a price tag most people aren't going to sign up for.
Yeah. Comparatively, though.
Comparatively, yes, and it's something that I think a lot more people can interact with, because it can get out into like these more ordinary clinical settings where you're not going to these specialized centers and things like that. And so I think, in the future, a lot of people can have experienced a kernel flow measurement, because we'll be in more settings and be closer to where the people are already. And I think that's one of our big value propositions.
Yeah, that's amazing. I love that. To get into some more technical questions, right now you do some task-free based acquisition. Is it possible to measure brain function with tasks using FNIRS, such as task-based fMRI?
Yeah, of course. And actually, the alcohol paper I mentioned kind of earlier in this discussion, we do a task-based measurement there. So there we're using an inhibitory response task. So it's called go, no, go. And the idea is that, we flash a pattern of symbols at kind of a regular interval, and you get in this interval, and then we flash one that you're supposed to not respond to. And so the challenge is being able to recognize that quickly and inhibit your response and say, no, I'm not going to respond to this. And this is what we used on alcohol, because one of the things we know about alcohol is it has a characteristic of lowering people's inhibitions. And so, could we pick up on some reduced ability to do inhibitory control? And so we use this task as a way, and the publication is there, and you can see very clearly that a couple of interesting things. So one is that, yes, as people consume more alcohol, you can see their performance degrade, but only at the highest amount of alcohol that we gave people. So there was this, we did 3 doses. We did a placebo, a moderate amount of alcohol, which is equivalent to a 0.04 BAC, and then we did a high amount, which is a 0.08. And so the behavior in this game only got worse at 0.08. But what we saw was that in 0.04, we could see compensatory brain activity. So your brain was actually working harder in order to achieve the same performance as it had in the placebo condition. And, we think this is really interesting and powerful, because there are a lot of cases where maybe behavior, one's performance on doing a task isn't sensitive enough to changes that are happening in their brain, whether it's in their cognition, in the case of cognitive decline, or in the case of a drug being introduced. And so you want to see the impact of a drug on someone's brain. And so using this task, you're able to probe it a little better by seeing both the behavioral performance and how the brain is responding to that behavior. So yes, we can do task-based stuff. We've done lots of task-based stuff. And I think we will continue to do a blend of resting state and task-based measures.
Yeah, absolutely. Yeah, you guys are building quite the data set on this device. And I have to say, it must be an interesting study to be getting people drunk inside a clinical setting.
Yeah, well, so we did we have a few measurement rooms here in our offices. And so we had people come in, and we had a room where they were given a very precise amount of alcohol. And then, we measured the breathalyzer to check how the alcohol was impacting them before we got them back to take measurements. But yeah, it was a lot of work. We were very responsible and careful about how it was all handled, and made sure that no one was driving home afterwards after drinking alcohol in the name of science. But the publication is there. It was great. We were really happy with the results. Again, it was measured with Flow 1. And I think in this case, it was about 50 healthy people that came in for measurement.
Yeah, that's great. Have you been comparing your data sets with any EEG or MEG data? And what are the main similarities and differences?
Yeah, so we mostly compare our data with fMRI. So again, fMRI is the most similar type of measure to ours. EEG and MEG, they're measuring faster responses. They're like measuring things at the neuronal level. Whereas fMRI and time domain FNIRS, we're both measuring these hemodynamic responses. So they're kind of lagging responses to things like task-based stimuli or things. So we have ways of producing those responses and measuring those and characterizing them. And we rely heavily on the fMRI literature as a reference point. And we see good agreement, generally speaking, with cortical signatures from fMRI and the signatures that we measure on Kernel Flow. So we've been doing some work there. We have some stuff underway now where we're doing a direct head-to-head comparison, same person getting measured in both. And we'll see how that turns out. But generally speaking, at the group level, we see good measurement and agreement between fMRI and Kernel Flow.
Yeah, that's great. To move on to your work with psychedelics, so you had the ketamine study come out recently. Will you just explain real quick to any viewers who aren't familiar with it what that was?
Yeah, so when we announced Flow 1, our friends over at Cybin came to us and they were really interested, right? So Cybin has always kind of been looking ahead. They're very forward thinking and how they think about both the psychedelic developments and how they do research and think about things. And so they came to us and said, hey, we'd like to do something together where we want to measure people who are undergoing a psychedelic experience using Kernel Flow and see if this could be a good research tool for us. And so we designed this ketamine study. Again, we used healthy individuals, healthy volunteers. So there was not a clinical question associated with it. And we chose ketamine specifically because it was the easiest to work with and kind of get through the regulatory process, right? Yeah. And so we wanted something that we could do quickly and with really low overhead and not have to go through a lot of regulatory hoops to do. So the idea was we would take ketamine and use it as a proof of concept to show that you could measure someone in Kernel Flow while they were having a psychedelic-like experience. And so we did that. We had 15 people come in. We gave them, they had 2 visits. One time they had an intramuscular injection of saline, so kind of a placebo. And then the second visit, they had an intramuscular injection of ketamine, and it was dosed based on their weight. And what we could see was, very clear signatures in the brain activity, differences between the ketamine and saline, as you might expect. And not only that, we took some questionnaires of things like reported mystical experiences, and we could show good correlations between magnitude of brain activity and the reported mystical experiences that people had in the study. So overall, it was a success. We kind of demonstrated, yes, you can do neuroimaging with Kernel Flow in a clinical setting. Someone can undergo a psychedelic experience and wear the headset comfortably and kind of get through this whole process together. So I was really happy with how things turned out. The publication in Scientific Reports obviously goes into a lot more detail. And it was great to work with our partner Cybin on this one.
Yeah, it's definitely a big one for for lots of different industries, but specifically for psychedelic science, because I think anyone who's ever taken a psychedelic will tell you that putting them in some big machine in a hospital is not what they want to do. I'm curious to know, because psychedelic experiences tend to be so different for different people, did you, and I know it's a small sample, but did you see any differences in brain activity from the different test subjects?
Yeah, so this goes back to kind of tying the magnitude of the response to the reported mystical experiences. So like people would tell us what their experience was like. We had a standardized survey that used pretty widely, and then we looked at how that compared with some of the measures we had from the brain, and so we could start to draw some correlations. As you said, small sample size, 15 people. Really just a proof of concept that this is possible and that there is information there that you can measure in this type of setting. And what we hope is that others will see this work and kind of say like, oh, it would be really interesting to have a tool like that we could use as part of a quantification of what this drug molecule, whether it's psychedelic or not, but what it's doing to the brain. And you can start to quantify functional responses, and we think that's kind of a starting point to better understand how some of these molecules are impacting the brain and how people's subjective experiences could maybe be anchored to something a bit more data driven and quantitative.
Yeah, man, how interesting would that be to understand what's happening in the brain during a mystical experience? That's definitely a study I'd like to see. Kind of like, I don't know if you're familiar with the Good Friday experiment, where they gave people psychedelics at church on Good Friday it was like one of the first studies on mystical experiences. It was 50, 60 years ago, so there's not really like good data on it, but it'd be interesting to see that concept come back and start to understand what a mystical experience looks like in the brain.
Yeah, I mean, I think yes, I think, and it would be really valuable and really not just out of curiosity. Like I think it's a question we would want to answer out of curiosity. It's just like an interesting question, but it could also be really valuable in helping determine things like dosing profiles or how we should apply psychedelics and these different drugs in order to treat people. Like I think there are tons of like really like high utility questions you could ask that are along those lines.
Yeah, absolutely. Because I mean, this was the first study where you're actually measuring the brain activity during the psychedelic experience. We don't have any data on that yet.
Yeah, well, this is the first time it was done with Kernel flow. There have been some folks who have done it with fMRI. Okay. So they have gotten people who have been brave enough to have their trip in an MRI tube. And, there've obviously been people who've done it with EEG. So like all different modalities. And this was the first time we really showed that you could do it with an fNIRS device. And I think the ketamine study was the first time that any data collected with fNIRS had been published. fNIRS and ketamine had been published. So it was a good step forward, and I'd like to see more steps that we could take, and again, working with great partners like Psyben and others in the field who have some questions that we want to help answer. Like we're all for that. So
yeah, absolutely. And based on the study, can you tell us anything about the effects of psychedelics in the subcortical regions using this device?
Yeah, so we only measure from the cortical parts of the brain. So we're not getting anything subcortical. And so that's one of our blind spots. We talked about trade-offs a little while ago, and we don't get the full picture of the brain. So there's been a lot of work on the functional connectivity networks and things that you can see in fMRI and how they're changed by psychedelics. And there have been some like beautiful images in the literature that have been demonstrated. And because we can only see the cortex, we don't get to see the full picture. We can only see kind of what's happening on the surface of the brain. But we can see that there are changes that are happening, and we can tie those changes to mystical experiences. And so we think that there's like a nice path where we can start to tie these measurements from the cortex both to clinical outcomes and the subjective experiences, the mystical experiences that people have.
Yeah, absolutely. Tell me a little bit more about what your plans going forward are with psychedelics. Do you have more studies in the works? What do you guys want to do with this?
Yeah, so we are currently doing some work um, with in the context of depression. So we're looking at people who are starting a treatment and measuring them before they start treatment, at a point in the middle of treatment, and then at the end. And we're starting to build up a database of how the brain at baseline can be used to predict who will respond to this given treatment. And so we're doing this now. Ketamine is one of the treatments that we're looking at, and then Spravato, which is esketamine, like two pretty widely used non-traditional psychedelics, I understand, widely used in the treatment of depression. And so we think this is a good first step in showing that we can tie clinical outcomes to some measures from the brain. And with that kind of in hand, we see a future where if there are these baseline measurements, these baseline biomarkers that are predictive of treatment response, then we could use measurements from Kernel Flow as a way to justify treating patients with psychedelics, right? So you can measure from the brain and see that they're a likely responder to psilocybin or MDMA or 5-MeO-DMT, right? Like if you can pick which psychedelic is the right one for this person, that would have a huge impact on the cost effectiveness of these therapies and overall benefit to the patient and healthcare system. So that's kind of what we're aiming at in the context of psychedelics, is really trying to figure out who the right person for a given treatment is. And you can use that same framework two ways. One is, we talk a lot about the patient, right? Like we want patients to be able to get better faster, and everything we're doing in the long term is in kind of service of improving the outcomes for patients. In the short term, working with partners who are trying to answer the other question. They say, I have a drug, who are the right patients that I should be using this drug on? Like, who are the most likely people to respond to that drug? And so you can use this ability to predict treatment response kind of both ways, in the development of the treatment and then in the deployment of the treatment long term, once you have good, robust biomarkers built up.
Yeah. Other than Simon, are you guys like what companies are you partnering with? Because like I see this having major implications on a ton of different things, obviously accessibility, cost effectiveness for, companies, also insurance companies. So like, do you have any partnerships other than Simon that you're working with right now?
Yeah, there's nothing I can say publicly about the things. Simon, we've been, the ketamine study we did with them, like all very public, and have all the press releases. But everything else I have to keep very close. But I would just say, generally speaking, that we're interested in partnering with people, and especially people that are working in this space where these new treatments that come out aren't going to be cheap. Right? Like I think a lot of the economic data around some psychedelic assisted therapies show that it's going to be a pretty relatively expensive treatment, especially compared to antidepressants. Like the current standard of care, although it's not great, is pretty cheap, and that makes it hard for insurers to want to get behind something like that. And we think that there's a future where data can really be the driving force behind increasing cost effectiveness and efficiency in the treatment of mental health issues, illnesses. So, if you have viewers or listeners who aren't working with us already and are curious to figure out what we could do together, I'd be more than happy to take those. But we have a few things going on, and I won't speak about it until we're ready to share publicly. But.
Yeah, absolutely. Well, I will say a couple of questions I asked that sound like they're from a scientist. We're from a neuropharmacologist at Imperial College who wanted to get some answers from you guys. So I know people are paying attention, and I'm super interested to see what you guys do, because there's kind of endless possibilities to it, right?
Yeah, I agree. And, we also like to talk to our friends at the universities as well. And, a lot of great ideas come out of universities, and a lot of new questions, come from kind of thinking about things in new ways. And the researchers at places like Imperial like have done a lot to push the field forward. And if they want to ask me questions, I'd be happy to talk about those too and see if there's something we could do together. Yeah, our goal is really to just push this field forward by making sure that we have access to robust, high quality data that you can use to quantify and predict things.
Yeah, absolutely. Do you see, I mean, I know you can't say who exactly you're working with, but do you see there being more interest from research institutions like Imperial College London or Johns Hopkins, or more for-profit companies?
Yeah. So far, we've been working more with for-profit companies. It tends to be a little bit easier to get things going when there's like an economic incentive that's all aligned. And in the case of more fundamental research, it's always about finding a funding source to really push that research forward. And we've kind of explored a few grant opportunities where we could partner with folks on grants as a way to kind of fund a new research question and drive that forward. But in the immediate future, a lot of the work we're doing is with the for-profit companies.
Yeah, wonderful. Before we finish up, is there just anything you want to add about what you guys are looking to do going forward?
Yeah, I mean, I would just say that generally speaking, going forward, what we're after is bringing precision to the treatment of mental health illnesses. The same way that really the treatment of cancers were revolutionized with genetics, right? Like that brought a new level of precision to be able to treat cancers that they didn't have previously. I really think we see that same opportunity around the brain, is that we don't have good understandings of the precise function of the brain and specifically the dysfunction of it, so that you can more effectively treat it and target those treatments to solving that specific type of dysfunction. And there's been a lot of great work out of academics that have shown that tools like fMRI and EEG can identify signatures that can be used in this kind of precision neuromedicine way. And what we really think we're going to do in the future is bring that to clinicians everywhere and be able to like take it out of research and actually bring it to the market, because we've built a new tool, a new technology that enables it, something that didn't exist before. And now, because it does, really, I think opens up a lot of opportunities.
Yeah, that's wonderful. Thank you so much for sitting down with me. I'm really looking forward to what Kernel does in the future. And I really see it as being at the center of the development of our understanding of the brain, also, psychedelic treatments and all of that. So thank you so much, Ryan.
Yeah, thanks, Charley. And it was great to chat. And I hope we can do it again sometime soon. So.
Yes, absolutely. We will definitely do that. Thanks for watching. If you have any questions or comments, please let us know below and make sure to subscribe. We'll see you next time.